Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Our topic for today is understanding arboviral diseases and preventing them. Joining me in studio is Dr. Reza Niles-Robin and Dr. Keisha Nelson from the Vector Control Services. Welcome to the program, Dr. Nelson.
Thank you very much, Ms. Martin, for having me here today.
So today we're talking about arboviral diseases. Tell us a little bit about this and what are the most common types here in Guyana?
Well, arboviral disease is such a broad topic, but it usually speaks of an infection that is transmitted to humans by the bite of an infected arthropod. In our context, the mosquitoes. What are some common arboviral diseases? I'll start with what everyone knows about, dengue. Apart from dengue, we also have chikungunya, Zika, Mayaro, yellow fever, as well as oropouche.
Is there a particular mosquito that transmits these type of diseases?
Certainly. So the Aedes mosquitoes are responsible. In Guyana, we know as the primary vector for these diseases to be the Aedes aegypti as well as the Aedes albopictus as a secondary vector to see.
All right, so you mentioned dengue. For persons who are watching and thinking, okay, I didn't even know about this. I know about dengue, but I didn't know that it's part of these arboviral diseases. It came under this category. Could you talk a little bit about what dengue is?
So dengue is a viral disease. It is transmitted through the bite of an infected mosquito to humans. It got its name because the virus that transmits through the bite of the mosquito is called the dengue virus, hence its name.
All right. I know a lot of people know about chikungunya. I know a few years ago I would have heard persons making jokes about it and all that. But let's talk a little bit about that chikungunya and what is that virus in itself.
So chikungunya, similar to dengue, is also transmitted through the bite of an infected Aedes mosquito. And interesting to note, like dengue, it has its origin or its name from the virus that is being transmitted to the humans.
Okay, what does the public need to know about arboviral diseases?
It is important that you'll know that prevention starts with both you and also me. What can I do to protect myself? So first of all, I need to ensure that I wear long sleeves. I need to ensure that I use my repellents. And of course, I must sleep under a mosquito net in the nights. That's what you can do to protect yourself. However, it is important that you keep your yard spaces clean, you cover your garbage bins, you also cover your water storage collections containers, keep your drains clean, and ensure that you tell your neighbor to do the same as well.
Thank you, Doc. What are some of the symptoms that persons can look out for with regards to these diseases?
So the common ones, fever. Secondary to fever, you may have a headache. Some persons have frontal headaches. Some persons just have it midway. In addition to that, pains is just like all over the body. So whether it's a retroorbital pain, which simply means pain behind the eyes, or if it's a pain in the back, pain on your shoulders, you can have a muscle pain, you can have a joint pain, and the list of pain goes on. But it's important to know that you can also have nausea, vomiting, as well as a rash may present.
How can persons tell the difference between arboviral diseases and the common flu?
I love the question because interestingly enough, what the common flu may present with are also respiratory symptoms in addition to what we would have mentioned. So you can have an itchy throat, you can have a runny nose, you can have coughing as well, to a part of the panel of diseases.
Okay, is there any danger sign that person should look for that says, hey, you should go to your health center or go to a health facility as soon as possible?
Actually, what I recommend, if you're sick, just go to your facility. But in addition to our usual recommendations, what I will say, if you note, especially for our children, you have persistent vomiting, if you have persistent abdominal pain, these are signs to say, listen, I need to go to the hospital. In addition to that, if you have bleeding of any parts, whether it's your nose, whether it's your mouth, you need to ensure that you seek medical attention.
Definitely. Thank you so much, Dr. Nelson. We're going to go into a short break and be right back with more on arboviral diseases.
The mosquitoes responsible for spreading dengue are most active during daylight hours and can breed in small amounts of still water. Here are some simple tips to safeguard yourself and your community from dengue at home, school, or work. Cover water collection points with a fine mesh or lid and regularly clean areas that can collect water easily, like plant pots, flower vases, discarded plastic containers, and pet water bowls. Ensure that your gutters and drainage areas are clear. Keep doors and windows closed or install insect screens to prevent mosquitoes from entering. Use mosquito nets, repellents, and vaporizers to keep mosquitoes away. And wear long-sleeved shirts and pants to protect your skin. Don't wait, act now. Together we can keep our surroundings clean and beat dengue. A message from the Ministry of Health.
Dengue is a viral infection caused by the dengue virus and is transmitted to humans through the bite of infected Aedes mosquitoes. Dengue symptoms can range from mild to severe. Mild symptoms include high fever, headache, body aches, nausea, and rash. Severe cases can cause intense abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, and blood in vomit or stool. Severe dengue can be life-threatening if left untreated. If you experience symptoms of dengue, seek medical attention at your nearest health facility. Dengue testing is available in all regions across the country. While there is no specific treatment for this illness, health professionals will provide the necessary care to manage the symptoms. Early diagnosis and treatment can save lives. For more information on dengue, call 225-8973. A message from the Ministry of Health.
Here are a few tips on how we can get rid of or reduce mosquitoes around our homes. Clean water blockage in the roof gutters and drain regularly. Don't keep any solid waste, for example, leaves or plants on rooftop. Clean and scrub all storage containers like drums, tanks, and buckets regularly. Turn over or cover containers not in use. Puncture holes in tires or fill them with sand to avoid mosquito breeding sites. Welcome back to the program. For those of you who have just tuned in today, we're talking about arboviral diseases and how to prevent them. With me in studio is Dr. Keisha Nelson. Dr. Nelson, tell us a little bit about what the Vector Control Services does with regards to preventing these types of diseases.
Indeed. So we have three main activities that we carry out on a daily basis to ensure that we manage the cases, to ensure that our transmission is cut. And so we do larval source reduction, which includes our house inspections, as well as larvicidal activities. We also do indoor-outdoor residual spraying and fogging. And they're done in combination depending on the cases that we find within the communities as well.
And I know that you guys would have been doing this across communities in all regions. How does persons within those communities respond to this?
Okay, so it depends. There are some interventions that are widely accepted. Everyone loves fogging.
Generally.
Yes, generally, we like fogging. However, it's imperative to note that as we strategize as a department and more so as a ministry and as a nation, it's important to understand that it's necessary that we have all of these interventions done in unison. One is neither better than the other. If you do one, you attack whichever stage, but you leave undone the other stages that are to be done. And so while we appreciate your warm welcome in terms of fogging, we also need to upscale our indoor and outdoor residual spraying, which is a bit more invasive, but certainly productive if we are to kill our adult mosquitoes.
Indeed. You mentioned breeding sites earlier. What role does the community play with regards to preventing breeding sites?
Wonderful, and thank you so much for the question, because like I said, in preventing dengue, it's everybody's responsibility.
Correct.
And it starts with you. What can you do? Ensure that your drains are not clogged within your yard spaces. Ensure that your bins are covered. If you are storing water, you ensure that that is covered. If there's anything that you have within your yard that you don't want to use any further, ensure that it is properly disposed of. Mosquitoes can thrive in one single drop of water. So that's basically what you can do to ensure that you keep yourself safe. Because if we're able to cut transmission from the immature mosquito stages, then certainly we won't have the adult mosquitoes to maneuver with.
Indeed, keep yourself safe and your community by
Indeed.
extension. We're talking about arboviral diseases. How is diagnosis done, and is there any way that persons can get screened for this?
Certainly. We provide screening across all of our health facilities, whether you're starting from a health post or you all the way up to district hospital, regional hospital, and ultimately our national hospital. Services provided across the board for each and every single region. So once you come to the facility and you present with the symptoms that I would have previously mentioned to you, you will have a rapid diagnostic test being done for you.
Okay, what treatment is available?
So to note for arboviral diseases, it is so non-specific. And so, of course, we'd have to categorize, first of all, diagnose you, categorize to see whether or not you require a hospital admission, or we can treat you non-specifically and have you go home with the necessary treatment. So it just depends on the category you're in. So for example, one of the most important things that we require to do as part of our treatment that sometimes we take for granted because we're like, man, that's not so important, hydration. Hydration, whether you're in the hospital setting or you're ambulatory setting, you need to hydrate. Keep your cells hydrated. Drink lots of water. And of course, because it's symptomatic in nature, we ensure that we do analgesics, which simply means your Panadol, for example, antipyretics. And what is wonderful about a Panadol, it serves both purposes. So we're treating both your pains as well as your fever. That unusual discomfort, we respond to it in a simple usage of your tablets correctly. Of course, for those who are admitted, we have to also consider the other factors like comorbidities, you know. That's important to consider. Your age, if you have another underlying sickness, for example, if you're hypertensive or if you're diabetic or if you're pregnant, these are all considerations that we take before we actually treat you.
Thank you, Dr. Nelson.
You're most welcome.
Many potential mosquito breeding sites exist around your home and communities. Breeding sites are anything that can hold water. These include tubs, tins, buckets, tires, pools, tanks, bowl, vase, tree holes, plant pots, and even something as small as a cork is enough for mosquitoes to breed. So let's join the national effort and do our part to eliminate mosquito breeding sites.
Dengue testing is done with a blood test. These tests are available across Guyana. If you're experiencing any signs or symptoms of dengue, please seek medical attention and get tested. Severe forms of dengue, if left untreated, can be life-threatening. If you test positive for dengue, please be advised to drink lots of fluids, get enough rest, sleep under a mosquito net, and use insect repellent. And only use Panadol or Tylenol for relief of fever and pains. Do not use aspirin or NSAIDs, which include ibuprofen and Aleve.
Welcome to the program, Dr. Niles.
Thank you for having me, Alicia.
Continuing on arboviral diseases, could you tell us what strategies has Guyana or the Ministry of Health in itself developed to combat and better manage the situations in Guyana with regards to these diseases?
That's a fantastic question. The Ministry of Health, the government of Guyana, has employed a strategy that is well known and recognized. It's known as the Integrated Vector Management Strategies for Arboviral Diseases. This strategy really speaks towards specific strategies used to control arboviral diseases. And just to mention, arboviral diseases are diseases that are spread from an infected insect, in this case, infected mosquito, to a human being, such as Zika, dengue, chikungunya. So essentially, integrated vector management, or IVM for short, really refers to an evidence-based decision-making process that allows us to use resources that are sustainable, cost-effective, and promotes multi-sectoral collaboration. I would group the strategies on the integrated vector management into four main categories, because really and truly IVM really speaks to using multiple strategies, multiple methods, and not depending on a single methodology. So the first would be environmental management, followed by biological and chemical control, surveillance, and social mobilization. The reason these are important, and I would say environmental management probably is the easiest one to do and probably the most important, because this simply refers to altering our environment to prevent the breeding of mosquitoes. What does it include? This simply includes, for example, clearing our gutters, clearing our drains, removing stagnant water, simply things like cleaning our tanks and putting fresh water and covering it. These really speak to soil waste management, improve soil waste management. So, and these are things me and you can do.
Definitely.
The most important are probably 80% of the strategy. The next thing is the biological control. This simply refers to using natural methods to get rid of the larva and the mosquito. For example, maybe using a fish in the drain or the pond that will eat the larva.
Yeah.
And then there's the chemical, which is probably well known. This means you judiciously using insecticides in the homes, and that's called indoor spraying, and space spraying like fogging, which everyone knows, and is effective for killing the adult mosquito. The other strategy refers to surveillance. We need data. Remember I said this is an evidence-based process. So we need the surveillance data from the epidemiology. So for example, how many cases we have in a region? Is this a potential hotspot? What is the intervention that might be needed? We also use the entomological surveillance, which refers to the insect surveillance, in this case the mosquitoes. Do we have a big population of mosquitoes here? We need to go and do some effective management. And of course, another important, I say probably the second, if not the most important as well, social mobilization. Reminding persons in the community, even myself, that I can control my environment. I can contribute towards getting my environment well, but also facilitate the vector control staff, the environmental health team, when they come in the communities, they help give that added boost to the vector control management. A simple strategy, walk around your home. 10 minutes, look, is there a tire that is gathering water? Put it over and store it appropriately. Is there a container that is open? Cover it up. Dispose of the water first, because maybe mosquitoes larvae already there. Cover it up and store it adequately. When you clean your gutters, it might encourage your neighbor to do so, and so on. And the effect of a healthy community is something that we can propagate. While you see your leaders on TV and on the radio, you and me can still do something.
Indeed. It needs a collaborative effort for our partners and stakeholders who are viewing this program and decide that they want to come on board. What can they do, and how can they reach you guys?
Well, they can reach us nationally at the Vector Control Services. We are housed within the GPHC compound, Middle Street entrance. Vector Control, everyone knows in the compound where we are. You can get us there. You can also call us on 225-8973. But for the regional level, you can also call your regional health offices, because they're all equipped with the necessary tools and the information to assist you a little bit more quicker at the regional and community level. But you can also call us and we can facilitate that communication between you and the region as well, or your community persons.
Awesome. Even as we move ahead in this new year, because we're just in the month of February, what can we expect from the Vector Control Unit? What are your future projections going forward?
Well, as I speak about the future, I want to mention some of the great things we've done so far, and that will help us understand where we're moving. So, notably, in the recent years, the Ministry of Health and Government of Guyana have spent over $500 million on the necessary vector control equipment, tools, protective gears, chemicals, and we have given them to not only the regions but to the NDCs and municipalities. So we've gone down straight to the grassroots so that we can have readily available action, field action that is, outbreak response, and even the inspection and the risk management at that level. Further to that, we were able to draft a guideline to give treatment and management for persons that have dengue and other arboviral diseases. We have training that was done in all 10 regions for IVM, because I've already mentioned how important integrated vector management is. We've trained in every single region annually, and we'll continue to do that again. Clinical management for our doctors, because the arboviral diseases, it is not that easy to distinguish in a few patients. So the management sometimes needs to be very generalized for arbovirals until you do the necessary tests. And we've been able to train clinicians, nurses, and all the other relevant healthcare workers in all 10 regions. We'll be continuing that again today. We've also been able to have the arboviral panel at the National Public Health Reference Lab, which means this panel will test for not just dengue, not just chikungunya, but it will test for dengue, chikungunya, Zika, Oroputru, Mayaro, and yellow fever.
Wow.
So we'll be able to give a very quick response in the case of we detect any of those following diseases I've mentioned and give the appropriate response. So in terms of what we'll be doing in 2026, because while we have these gains, we want to improve. One of the things we want to improve on is the NDCs and the regions having everything that they need, and they're perpetuating the training. So we'll train them and we'll reinforce it, but they continue that training and to go out and do more inspections. So any persons that want to come on and be a part of the vector control teams in the regions, reach out to your regional health office, because we need more bodies on the ground. Another thing that we'll be doing is pushing more diagnostics. So we have a lot of the RDTs and drugs available for the regions. We'll make sure that they're well equipped and prepared. So I would say our main emphasis in 2026, apart from maintaining, because one of our biggest outcomes is that we've seen a decrease in the positivity for dengue.
Wow.
I know what that means. It means that the transmission of dengue, we're seeing that we can believe based on the evidence that it's going down. But we still need to be cautious, because remember I told you environment. We need to make sure our environment is not perpetuating transmission. And that's where the vector control part comes in, but that's where me and you come in. So our plans for 2026 is make sure we maintain those gains, but more training, more reinforcement, more monitoring, and more engagement with me and you, because the power to deal with these diseases is within our hands. Something that I didn't mention but is key, sleeping under a net. We've always done that, but sleeping under a net that allows, IVM speaks to making sure that the mosquito's contact or the vector contact with the human is reduced. So if a mosquito doesn't bite you, then we can't get the disease. So without the mosquito, without our infected mosquito biting us, we can't get a disease. Mosquito can bite you, but if it's not infected, we should be very safe.
Correct. Before we wrap up today's program, Dr. Niles, do you have any final words of encouragement to our listening and viewing audience?
Yes, I do. And I'm sure the audience has already picked up on the strategy of what me and you can do.
Yes.
While the Ministry of Health and the government of Guyana and all the other sectors are working to ensure a clean environment and the necessary vector control, I want to empower you to take charge of your home, in your yard, no matter where you're living. Ensure that it's clean. Weed that yard. You might see something, fill it up with some sand or mud or whatever you have. That bucket that is open there outside catching rainwater, cover it appropriately, so that no mosquitoes can lay there. Also, that flower pot that you love to water, might have too much water, just tip it, so that the mosquitoes can't lay their eggs there. And you start encouraging your neighbors and eventually we'll be able to see that impact. We've started to see small gains,
Yes.
but I can imagine all of us working together in a concerted manner, what more
It will
we can
be even more great.
Indeed.
So thank you so much for joining me in the program today, Dr.
Thank you for having
Niles-Robin.
me.
I want to encourage you to keep up the good work that you guys have been doing down there at the Vector Control Services.
Thank you very much.
Thank you for staying tuned with us. I'm Alicia Martin saying goodbye for now.